It's different. It's a trip. I'm thinking for the summer. So, thank you. You good? Yes. Yeah, we will. You want to say it? I got one more letter. It is now 10 o'clock, and I ask that you please rise and join me for an invocation and also the Pledge of Allegiance. Lord God Almighty, we just come this day thanking you for this day. We thank you for being here in our presence, giving us wisdom and guidance in all that we do. We thank you that you will continue to give us all that we need to do to continue to represent your people of here in Henry County. We say thank you for this and all things, and all those that agree with me in Jesus' name, please say amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. The meeting of the Board of Commissioners is now called to order. I now call for a motion to accept the agenda.
So moved.
We got a motion by Commissioner Holmes.
Second.
Got a second by Commissioner Wilson. Any discussions or comments? All in favor? Any opposed? We're now moving to the main agenda item today, which is a resolution to adopt the 2017-2018 Henry County Employee Health Insurance Plan, and we invite up Ms. Doris Patterson.
Good morning, Chair Wood, Commissioners.
Good morning.
Good morning. The resolution that you have in front of you is a resolution to the Henry County Board of Commissioners to approve and adopt the Henry County Employee Benefit and Insurance Plans for 2017-2018. I'm presenting this resolution on behalf of the County Manager, on behalf of Human Resources, and on behalf of the County Manager Executive Team. I'll give you some brief highlights, and then I will actually read the resolution itself in its entirety. For the last 3 years, the county has taken on an increase to employee health insurance. In general, the insurance costs are rising each year across the board. Our task this year was to minimize the increase as much as possible, both to the employees and to the county. In addition to the big picture, we also have to look at and evaluate medical utilization and move towards an environment with more stringent wellness parameters, which will require more participation from all employees. And with that in mind, we will be spending time beginning after the start of the new plan year looking at expanding our specific wellness parameters to go into effect the following benefits plan year, which will be 2018-2019. But for now, what we have on the table is the renewal for the employee insurance for the upcoming planned year. Our team, which included the county manager, human resources, finance, and budget, thoroughly reviewed and evaluated each of the proposals that was put on the table. And so what we've attached in the resolution shows a $4.2 million cost for our employee medical insurance for the next plan year, which is a pared down number actually from the original quote of $5.3 million. We're recommending to continue offer 2 medical plan options for our employees, Blue Cross and Blue Shield and Kaiser, and add a mandatory Medicare Advantage plan for retirees age 65 and over. We would also like to note in the recommendation to the BOC that our employees would pay only 12 to 14% of the total premium cost. So in consideration of the budget planning process, we are representing 3 options for your review. The option for the county to absorb the full increase of the medical costs, not to pass any on to the employees. The option for the county to absorb 85% of the increase and pass the remaining 15% to the employees. And the option for the county to absorb 75% of the increase and pass 25% on to the employees. So the recommendation of the county manager's executive team is that the board choose option 3 as presented above, that the board not enact any plan changes to the medical plan structure for the upcoming year, which means that co-pays, deductibles, out-of-pocket amounts, including spousal and tobacco surcharges, remain the same, and that the board implement a mandatory Medicare Advantage plan for retirees 65 and over to provide the same level of coverage, but shift the individuals to the Medicare Advantage plan as their primary coverage to lessen the county's financial impact, but have no reduction in service or benefits for the retirees. Also, authorize the county manager to solicit proposals for consultant broker fees for 2017-18 for administration of all insurance policies and flexible spending, and then to have the insurance carriers remove all commissions from the premium cost structure as shown, thereby further reducing the premium cost, and instead pay a set consultant broker fee each month to a designated consultant. Offer an incentive program to Henry County current group enrollees if they choose not to enroll in the county's medical plan, but enroll instead in their spouse's group plan for 2017-18, and also to those employees who are currently unenrolled in the county's plan, and remain unenrolled, that they have medical insurance with their spouse's plan as well, that they would be eligible as well for the incentive. Allow and authorize HR to implement a comprehensive wellness planning and program effort beginning in the new fiscal year, which would include planning and specific requirements for the following benefits plan year, 2018-2019. Some of the recommendations include tiered rates for employees who participate in wellness screening activities and preventive programs, for instance, smoking cessation, participate in wellness screening programs, for instance, blood pressure and weight reduction programs. The idea is to encourage employees to do their part in helping to reduce total coverage costs and to reduce claims high utilization, while the county would continue to implement additional ways to minimize premium increases. We do recognize that additional employee educational programs will be needed before we can fully transition into these programs, which many employers have frankly already implemented. So we do plan to spend a lot of time over the next several months phasing in several employee educational initiatives to lead us into that effort with the intention of recommending and implementing expanded wellness parameters for 2018-2019 to further offset anticipated cost increases. I would like to read the resolution at this time. This is a resolution of the Henry County Board of Commissioners to approve and adopt the Henry County Employee Benefit and Insurance Plans for 2017-2018. Whereas the Henry County Employee Benefit and Insurance Plans for its employees and their families are up for annual renewal, and whereas the county sought proposals for employee insurance plans which include medical, vision, dental, life, and disability, and whereas proposals for medical insurance were received from Aetna, Blue Cross, Blue Shield, and Kaiser, whereas Blue Cross Blue Shield, Kaiser, and Aetna also provided alternate rates with several options, and whereas county staff consisting of representatives from Human Resources, Budget, Finance, and the county manager reviewed quotes from Blue Cross Blue Shield, Kaiser, and Aetna, and whereas Blue Cross Blue Shield reflected an annual 31.2% aggregate increase based on a renewal of the current plans with commissions estimated at $220,273, and whereas this year the county will offer a mandatory Medicare Advantage plan with Aetna, having proposed a Medicare Advantage plan for retirees 65 and over, and whereas Kaiser continued to offer last year's Kaiser HMO plan option for employee selection with an 8% increase to last year's policy, and whereas additional quotes were requested from Blue Cross Blue Shield and Kaiser for 100% group insurance medical coverage for the June 1st, 2017 to May 31st, 2018 policy year, and whereas Blue Cross Blue Shield offered to reduce its quoted rates by 1.2%, which resulted in an overall increase because of increased premiums to switch over the current Kaiser enrollees to a Blue Cross Blue Shield plan, and whereas Kaiser offered 3 different plans with 3 different plan choices within 2 of the plans and 2 different choices in the other plan, with reported savings to Blue Cross Blue Shield, but not with comparable Kaiser plans being offered or similar employee plan changes. And whereas the recommendation from county staff is to offer offer Kaiser Medical, Blue Cross Blue Shield medical plans, and the Aetna Medicare Advantage plan mandatory for retirees 65 and over for the period of June 1st, 2017 through May 31st, 2018, And whereas Blue Cross and Blue Shield rates are dependent on the carrier being awarded the medical, except for Kaiser participants, and the dental plan and vision plans. And whereas the Blue Cross plan will offer 2 plan options for active employees, an under 65 retiree selection, and Aetna will offer 1 mandatory plan for retirees 65 and older and over. And whereas the Blue Cross plan will offer the following services: employee assistance program and COBRA administration. And whereas there will continue to be a tobacco surcharge of $50 per month per family with tobacco users. And whereas there will continue to be a spousal surcharge of $50 per month for those employees whose spouses are eligible for health insurance at their place of employment but who choose to enroll in the Henry County Health Insurance Plan. And whereas the county will offer an incentive program to Henry County current year group enrollees if they choose not to enroll in the county's medical insurance, but instead enroll in their spouse's group medical coverage for 2018, and to those employees who are currently eligible for the county's plan and remain unenrolled and have medical insurance on their spouse's plan. Whereas Blue Cross Blue Shield will continue to provide $75,000 in wellness funds. Whereas Blue Cross Blue Shield will continue to provide dental insurance at the same rate as 2016-2017, as the second year of a 2-year rate guarantee with estimated annual commission of $49,824 in the rates. And whereas Blue Cross Blue Shield will continue to provide vision insurance at the same rate as 2016-2017 as the second year of a 3-year rate guarantee with estimated annual commission of $11,575 in the rates. And whereas 9 proposals for group basic and optional life insurance and short and long-term disability insurance were received from Blue Cross and Blue Shield, Cigna, Voya, Symetra, Lincoln Financial, Aetna, Unum, Sun Life, and Standard. And whereas Voya submitted the most competitive life insurance rates with equal offerings and service and is recommended for the 2017-2018 plan year with a 3-year rate guarantee, which includes estimated annual commissions of $49,035 in the rates. And whereas Cigna submitted the most competitive rates in both short and long-term disability insurance with equal offerings and service, and staff recommends staying with Cigna, who also is offering an additional 2-year rate guarantee, which includes an estimated annual $38,371 and $32,355 commissions in the rates for the short and long-term policies. And whereas Cigna will continue to provide FMLA administration at a charge of $35,000 annually, and whereas the designated consultant will offer the flexible spending account service at no additional cost to the county, and now therefore be it resolved that the Henry County Board of Commissioners approves the Blue Cross Blue Shield, Kaiser, and Aetna plans for medical insurance, Blue Cross Blue Shield for dental and vision insurance, Voya for group insurance, life and optional life insurance, and Cigna for long and short-term disability insurance and FMLA administration, with all plans including commissions within the premium rates charged. Be it further resolved that the Henry County Board of Commissioners will A, incur 100% of the medical premium increase for this renewal at a cost to the county of $4,242,232, an additional net increase to the county for other plans of $64,248, $35,000 for medical administration, $5,000 for COBRA, or B, incur 85% of the medical premium increase for this renewal at a cost to the county of $3,515,151, an additional net increase to the county for other plans of $64,248, $35,000 for FMLA administration, and $5,000 for COBRA, or C, incur 75% of the medical premium increase for this annual renewal at a cost to the county of $3,030,768, and an additional net increase to the county for the other plans of $64,248, $35,000 for FMLA administration, and $5,000 for COBRA. Be it further resolved that the Henry County Board of Commissioners, Option 1, will provide an incentive program to Henry County current year group insurance enrollees if they choose not to enroll in the county's medical insurance, but instead enroll in their spouse's medical insurance coverage for 2017-2018, and to those employees who are currently unenrolled in the county's plan and remain unenrolled and have medical insurance on their spouse's plan. Option 2, will not provide an incentive program to Henry County current year group enrollees if they choose not to enroll in the county's medical insurance, but instead enroll in their spouse's group medical insurance for 2017-2018, and to those employees who currently are unenrolled in the county's plan and remain unenrolled and have medical insurance on their spouse's plan. And be it further resolved that the Henry County Board of Commissioners will authorize the county manager to solicit proposals for a consultant broker for the upcoming 2017-2018 policy year for administration of all Henry County insurance plans and flexible spending account service at a flat rate charge for the period June 1st, 2017 through May 31st, 2018, and have all insurance companies then reduce their monthly premium rates to effectively remove all commissions, which are estimated annually at $458,835 within the premiums accepted for all insurance coverages in this resolution. Be it further resolved that the Henry County Board of Commissioners will continue the tobacco and spousal surcharges at $50 per month. Be it further resolved that the Henry County Board of Commissioners will accept the Blue Cross Blue Shield administration of the Employee Administration Program, COBRA, and Blue Cross Blue Shield 75,000 wellness funds. Be it further resolved that the Henry County Board of Commissioners authorizes the board chair to sign all documents required to execute this resolution. Thank you, and that is it in its entirety.
Okay, we've heard the presentation from Ms. Patterson, and we're now going to just open it up for questions and comments at this time from the board. Any questions or comments?
I do have on the Blue Cross Blue Shield plan, on the employee plan, if we go up, can you break it down how much it costs it would add to the premiums?
Sir, I'm sorry, can you repeat your
15%.
question, please?
On the Blue Cross plan, the family plan, I'm looking at a figure $164 a month. Is that
Okay.
correct?
I'm going to call the county manager and the finance director to assist with answering the cost piece of this. The finance director will have the actual numbers.
Good morning, Chair and board members.
Good morning.
Commissioner Wilson, it depends on which option the board elects. So if we look at the 25% option, currently an employee, and I will just look at the family costs. Currently, the employee cost is $164.83. If we elect to do the 25% pass through to the employees, that cost will go to $282.19. Now, if we break it down a little further, the actual increase would be about 46 cents per hour based on 160 months. Would you like for me to give you the numbers for the 15%
Yes,
as well?
ma'am.
Okay. 15% currently for family coverage only, an employee, and this is on the 80% HMO Blue Cross Blue Shield plan. An employee would pay $164.183. That's the current rate. Based on the increase, which we're going from a 10.9% increase to an 11.9% increase, an employee with a family would pay $235.25. That would equate to about 27 cents per hour.
Okay, can you also cover the 100%, just to make sure we're covering all options?
Commissioner, let me clarify. And then I will share the 100% would be the same amount that they're paying now, because it's not going to change. It would be the county taking on 100% of the cost, so the rates would remain the same. Commissioner, I looked at the wrong column. For a family, for the 25%, the family would be 73 cents per hour, not the 46 cents per hour. I was actually looking at the spouse only. For the 15% plan, the family would be 44 cents per hour versus that 27 cents per hour.
So we're looking at 282 increase. That would be the total for the 25%, then we're looking at 235 basically for the 15%.
That is correct.
Okay, thank
And
you.
if you take those numbers, just so that we can compare, currently, the employees are paying the $164.83. That represents about 10.9% of the cost. By increasing it, it takes them from a 10.9% increase to a 14.3% increase under the 25% plan. Under the 15% plan, they go from a 10.9% to an 11.9%.
Okay, thank you.
No problem.
Sherry,
Yes, sir.
if we would save any money by going with either Blue Cross, Blue Shield, or Kaiser as the sole provider. I'm trying to figure out a way of not passing any of these costs on to our employees. I do see some people here. I'm wondering if they're with Blue Cross or Kaiser, if they can come up and present if there would be a savings if we were to choose either one of them on a sole source basis, if they were prepared to speak on that.
And Commissioner, if there are representatives available and the board elects to have them come up, I certainly have no objection to that. But I also would like for our finance director to come up because Fred has done a lot of running of the numbers based on the information that's been provided. The challenge with staff trying to get a hard number is, I think if you'll recall from Doris's lengthy presentation, the Kaiser's plans, there were multiple plans within a plan. And so we had to try to figure out which plan would actually be comparable to that Blue Cross Blue Shield plan. So before those representatives come up, if we could just let Mr. Aletta give us a very brief update on what he's been able to find, and certainly if it's the wishes of the board for Blue Cross Blue Shield and Kaiser to come up, I certainly have no objection to that.
Kaiser plan, one of the Kaiser plans is, as Ms. Patterson said, there were three, and we got a fourth one on Thursday of last week before the holiday Friday, and I've done a little bit of work on it. But I took what was, if you look down here, this is $3,184,000. Oops, right there. That was the savings that Kaiser had shown on what they call a 1500 or a 1500 OOA program. And in using that, what they have said is that 902 of the present 1,234 Blue Cross employee enrollees. At the present time of our total enrollees, 1,234 are presently on a Blue Cross program. 180 are presently on a Kaiser plan. And the Kaiser plan is you can only go to Kaiser. So if I say Kaiser HMO, for my purposes, I'm saying that is the present Kaiser plan in which the employees can only go to Kaiser. So the employees this year have Blue Cross Blue Shield, two plans, 75 and 80%. There's 902 of them on that. What Kaiser is saying under their savings of $3 million is that 902 of the 1,234 people will now take the same plan that they haven't taken when it was offered to them, and instead took the option of a Blue Cross plan because it allows them to go to their doctors or other providers as opposed to only Kaiser. So when you look at this $3 million savings, and that's how they came up with it there. I took the exact schedule.
Excuse me, Fred, do you have a hard copy for us? I can't even read it.
Can't read it? I thought maybe.
I need a hard copy. I don't know, it's so blurry, I can't see nothing.
It's the depth of field.
Can you zoom in on this? Maybe if you can zoom in. There you go.
That's better, thank
It's
you.
better.
So what I've done here, and I'll move it around, but I've now come up with what I've said is under the present scenario, I'm saying that none of the people will go to the Kaiser HMO plan that they had 902. In other words, if choice was there today and they didn't take it, just because there is no Blue Cross to pick from, I've said none of them will go, but they will go to the multi-choice plan here, excuse me, so basically what I've done is moved the 902 up above to the 1,100 to make this 1,199. That changes everything there. The other is, under the Kaiser charge, employee charge, they are charging $146. I got to get, there it is. Under their savings for $3 million, they're charging $146, $293, $262, and $475. Each of those rates are higher than our present rate that's suggested at a 25 or 75% Blue Cross rate. So what I did is I went ahead and said, okay, let's plug in our rates of 89, 185, 167, and 282 so that the employees are being charged no more for going to Kaiser than they would have if we'd stayed with Blue Cross under an 80% plan.
So, it looks like you picked the most expensive plan, and there still was almost a $300,000 savings.
Now, it's a $1 million savings, but there's also an issue here, and that is this. I came up with $1 million in savings on those two changes. But what I also found out is, even with the changes I made, the amount of chargeback to the employee under the Kaiser scenario above, it's still $743,000 more, $743,000 more being charged to the employees through this. And as a result, the $1 million savings is really because $743,000 of it is coming from charging the employees more than what was being charged by Blue Cross under the 80% plan. If I use the 75%, Commissioner Holmes, it would be even greater difference because the 75% plan charges the employees less, which means the county would absorb more. So I've used the higher to reduce that figure.
And Commissioner, I think it's important to note, in terms of taking those 1199, those employees, and putting it under that Kaiser MC, we were under the assumption that a number of the employees want to be able to choose which physicians and doctors they are able to go to. So we're assuming that most of the employees, if they are going to have to choose between having Kaiser versus having Kaiser exclusively, then what they're going to say to us is we want to be able to use our doctors that we're currently utilizing.
So basically, when the $1,040,000 that is calculated with the two changes I made, moving the employees to the multi-choice and also reducing the rates to the employees, still is a $743 increase over Kaiser, and that reduces it to $296. The other is that the Kaiser rates that we presently have received when they were only going to cover 180 employees, which is the 180 presently on the Kaiser HMO plan, the rates that we've now been given for 100% exclusive Kaiser, those rates went up. So the rate for those 180 people will also go up. In other words, it's not two plans. Everybody in the 180 today will have to move to the exclusive plan rates, which are higher than the rates we have got from Kaiser. And the explanation for that is given is that when they take on the entire group, they're taking on more, what's the best word? Yeah, the employees, they're taking the whole group where the employees are not maybe the ones that are less likely to have claims. And as a result, they had to raise the overall rates for the entire group. So that's a $32,000. So there still is a $262,000 moving it under this scenario versus the $3 million they had given based on the three changes that I've just indicated and calculated. So that's the increase that you would get having the employees have the choices with the 100% Kaiser. under this particular plan. And again, I picked this one because the others were $1.6 million and so on and so forth. This one was a $3 million savings. So I picked the biggest savings to try to figure out what would happen if these two scenarios I changed would be changed.
And just for information purposes, will you review again how many of our employees are currently on Blue Cross, how many are on Kaiser, and how many others do we have?
Yeah.
Just so that we've got the full
Yeah.
picture stated.
1,234 total Blue Cross enrollees today and 180 Kaiser enrollees today. Total 1,414 people are on one or the other insurance program.
Okay, Commissioner Clemens?
So I have a question for you in reference to the $262,000 savings. That is with multi-choice, correct?
Correct.
So that means that even though we go to this and we save $262,000, our employees will still be able to choose their own doctors. They don't have to go to Kaiser.
One of you.
They'll be able to choose their own doctors, but at this point, we don't know what physicians are listed on that approved doctor's list. So it is a multi-choice, but there is no guarantee that doctors that you currently see are part of that multi-choice list. And that's something that we have not been able to receive.
Isn't that the same way with Blue Cross Blue Shield, though?
No, not on the 80% HMO plan that we have, not that I'm aware of.
Okay.
What we do know is that the people today that are on the Blue Cross plan are going to the providers they desire.
Correct.
And what County Manager just said is, at the present time, we don't have a list of those providers that those Blue Cross enrollees are going to have given it to Kaiser to say, do you have all these in your multi-choice plan? That information has yet to come forward, so as a result, there is no comparison. It's been said that it's 95% same providers, but I can't quote that and accept it because I haven't seen any comparisons.
So I would like to know from Kaiser so we have this savings if we go 100% with Kaiser. I would want to know if they choose a doctor that's not on that list, how does that look? Or are they just not allowed to? Is there a different fee for that? How that would work for us, if we could have them to answer that.
We can invite them up to answer that one question, or that question. So Kaiser, that is an important question.
I believe that would be then the need to go to the OAA coverage that they offer. And again, as this is looked at here, there are 3 plans shown.
Well, I want to ask them about this one
Sure.
that we're looking at now first, because this is a savings. And so if we look at the savings and hear from them on that one first.
Okay.
And the question we have for Kaiser is if our employees would have the option to choose their own doctor if they're not within their current network.
Address what Fred stated regarding the various plans as well.
Well, I'm going to actually play to the board. The only thing I think about is that the staff has made sure that they compared apples to apples, and I'm not sure if Kaiser has seen all of that, but, again, we can allow them to speak.
And certainly, before Kaiser speaks, again, understand all of the information that we've received thus far has been in the span of about 2.5 weeks. And so we've really tried to pull together what we think would compare to our current Blue Cross Blue Shield plan, but realize, and I think this is important for the board to understand, time is certainly of the essence for us. The current plan that we're under will expire on May 31st. And so we've got to move forward in terms of making a decision so that we can begin our enrollment process.
Thank you. Okay.
And I think the biggest decision is that how do we save? Because we're looking at $4.2 million that we don't know where it's going to come from. So I think we need to definitely be expeditiously making a decision, but we also got to make sure that we make a thorough decision to try to find savings.
Oh, absolutely. And I think part of the resolution that Ms. Patterson read leads to how we're looking at making those savings. If you recall, in that resolution, we looked at the commission rates that we want the board to authorize the county manager to proceed with a solicitation for a consultant and broker services to handle this going forward in terms of some of the wellness activities that we want to incorporate. We've also looked at adding, as part of that resolution, incentives for those employees who elect not to utilize the county's health insurance. And so that is part of this resolution as well. And if you all will recall, when we had some other meetings, some of the things we talked about were the savings if we were to take employees off of our current plan. So I agree, Commissioner Clemens, we've got to look at how can we cut those savings, but we're just under a tight schedule. Thank you.
Well, and I'd like to say, let's go ahead and let Kaiser speak, and then we've got some other questions. I know there's other questions that need to be asked. Okay? If you could, sir, give us your name and so forth.
Good morning. Good morning. I'm Greg Williams with Kaiser Permanente. Madam Chair, Commissioners, they're right. There's a lot of work being done in a short amount of time, and we have not actually looked at the information that that was presented here this morning. But when we look at our information, assuming that they've done the math and everything is correct, it shows a $200,000 savings. Let me answer the first question regarding the availability of doctors. Our multi-choice plan is using PHCS, Physicians Health Network. It's the largest PPO in the United States. And he's right, normally 95% of the doctors in Blue Cross, Aetna, or United's plan are all included in PHCS. But there is a report where we can run a disruption report to show you exactly which physicians are in PHCS versus Blue Cross. The other thing I think with the numbers that has not been presented to you this morning is that Kaiser also offered a premium holiday. That means we will give you 1 month's free premium. So if you look at it, whichever plan they take and it comes out to be $1.3 million, that's $1.3 million worth of savings we're offering the county. Also, to help you in your budgetary as you move forward, we also offered a rate cap in the second year of 8%. So it gives you a budgetable amount. You don't see the fluctuations that you're seeing currently.
Okay, and then regarding the physicians that you spoke about, you said that 95% are included in the HMO. What about those who are not included in your network plan? How would those be handled?
If
for
they're
your
not
employees?
included in the multi-choice plan, then what we would do is would go to multi-choice and ask them to consider adding these physicians. And that's done all the time, but it's up to multi-choice. It's up to Physicians Health Network, because we are vendors. We use that network, just like Blue Cross probably uses them in their out-of-area places that they can't cover. So we are all clients of PHCS, and we will go to them and on behalf of the county ask to include those physicians. But we have no control whether they will accept them or not.
Thank you. Any other questions for Kaiser? And then we need to see if there's any Blue Cross representatives out there to give them equal opportunity as well to address anything. Any other questions for Kaiser? Thank you, sir. Thank you, Mr. Williams. Representatives from Blue Cross Blue Shield.
Madam Chair, Commissioners, appreciate the opportunity to be here with you today. My name is Ron Kerr, and I am a senior account executive with Blue Cross and Blue Shield of Georgia, and I've worked with the county for several years. Happy to answer any questions. I did not specifically participate in the analysis that Mr. Letta reviewed, but would be happy to answer any questions relative to Blue Cross and Blue Shield.
Any questions for Blue Cross Blue Shield? All right.
Good.
Thank you, Mr. Kerr.
Thank
Appreciate your availability. We'll ask the county manager and her team to come back again. Is there anything that you would like to add, it seems, based on the two representatives that just spoke, before we move to other questions?
Just in terms of clarification, in terms of the listing for those physicians, we did seek to obtain that information from both Blue Cross, Blue Shield, and Kaiser. And as of today, we have not received that information because we knew that we needed to be able to provide that to the board in case that question did come up. I think Mr. Williams indicated that part of the proposal also included a guarantee rate. We did have an opportunity to look at that, but there are a number of restrictions that come along with that guarantee rate. And that was certainly something that we weren't sure that we would ever be able to meet in terms of the restrictions. So again, we're going through a lot of information, trying to understand what's being asked and what the proposals are, but just wanted to give those two clarifications and be more than happy to answer any other questions that you all may have.
Any other questions from the board? Commissioner Prince?
Actually, I'd like to take a second just to speak to the citizens real quick so they can get a good understanding of what's going on here. I really want citizens to understand the gravity of this issue. Right now, we're looking at a 31.2% increase in our insurance. That comes out to be $4.2 million. This is an instant where decisions in Washington affect decisions that we have to make down here at the local level. $4.2 million hitting our budget. I didn't see this coming. I did not see a 31.2% increase. We only have limited places to get our money from, and majority of it comes from the citizens. So when we start talking about a $4.2 million increase to our budget, it will affect you, the citizens. And what we're discussing here today is how much does that get put over on the employee, and I want the citizens to realize any amount that we roll over to the employee causes the employee's pay to actually go down. The economy just kind of rebounded a little bit. We've added a little bit to the employees' salaries, but this will decrease their salaries, every amount that we put on there. Inversely, if the less we put on there, the more it affects the taxes. So it's kind of a balancing act. Now, to the county manager, I'm not real comfortable with someone coming up here and throwing numbers out just randomly and I know it's not you, but the 1.3 million in savings and things like this that's presented in front of the citizens when we're not sure if this is actually, if we're comparing apples and apples. And I want the citizens to realize, we try to make the best decision we can, but sometimes, we hear these, there's gold at the end of the rainbow, and there isn't. Because we were pitched this, and there was going to be a $3 million savings, and then when Fred went through all the data, there was not. So I'm a little uncomfortable as we've thrown out a $1.3 million savings figure. As a citizen, I would be sitting back saying, why don't the commissioners do this? Can we get the data on this? I know we need to move on this ASAP, and I'm wanting to make a decision. But again, as a citizen, I would be wondering why the commissioners made a decision not to save $1.3 million if they could. So where are we at on getting, and two questions. One, when do we need to make this decision? Second, where are we at on getting this actual data and comparing apples and apples, like Fred did with the other $3 million in savings that was not a $3 million savings?
Okay. First question is, we need to make a decision today. As you all are aware, we received the information about 2 months ago in terms of what our increases were going to be, and we've been working diligently trying to get that number down. And when I say we, staff has made several attempts to reduce the amount, because originally the amount was not $4.2 million, and as a result of staff having several conversations with both providers, we were able to get that reduced sum. I will tell you, time is of the essence because our plan will expire on May 31st. What that means is, and because the public is hearing this, and I'm certain that our employees are hearing it as well, May 31st means that our plan expires. That does not mean that they will not have service or coverage, but that will mean that if we don't have something in place, we will have to go back to both providers and ask for some type of extension, which will ultimately result in an increase on top of what we're already experiencing. I will tell you that based on staff's analysis, it appears that the savings is about $262,000. We have not been able to quantify that it is the 3.2 million based on the information that we have. Again, there are a lot of unknowns because we don't know what plan the employees are going to take. All we can do at this point is make assumptions in terms of what we think the employees will take. I feel very comfortable about our assumptions simply because Kaiser currently offers a plan to employees, that every employee has that option to take. Of that plan, we only have 180 employees who have elected to take that option. So to go exclusively to Kaiser and make the assumption that all 1199 will now take a plan that's currently being offered to them, I don't think that that is a fair assessment. Again, we really need to move on this today. I will tell you, as part of the resolution, I will stress it again, we understand that this can't occur next year. We've got to be ahead of the ball here. And so we're taking the next steps to make sure that going forward, we have the information available to you all as early as August or September so that we'll know what we're going into. I hope that answers the question. If not, I'll be more than happy to continue expanding.
Yeah, wait a minute, let's come to Commissioner Barham, and then we'll come back to another commissioner who hasn't spoken. Commissioner Barham.
Ms. Matthews,
What happens if we do delay? You said you'd have to go back before both insurance companies to see what those numbers would be. We're getting a lot thrown at us, and it doesn't look like we got all the information today. I would like to extend this for at least a 30-day period, and if we had to pay a little extra or whatever till we get all the information, but just don't seem like we have all the information, what would those costs be?
I will tell you, last year, we ran into the same situation, and again, I'm trying to remember from memory, when we went back to Blue Cross Blue Shield, it was going to be about a 16% increase to carry us for another 3 months. Both of the providers are here, and I'm sure that they're not in a position today to give us that information, but that is certainly something that we can provide. Again, I would strongly recommend that at this point, we proceed in the direction in which staff has recommended. When we talk about going to just providing one provider exclusively for our employees, we need to educate our employees on what we're doing, and we need to give them an opportunity, if they elect not to go with one of the providers or an exclusive provider, to have another choice. And typically, that would be about a 30 or 60 to 90 day window in terms of changing our providers. I think for our employees, we've committed to them indicating that every year we're not going to change carriers. We've got to have some stability in terms of what we're providing and the carrier that we're providing. So it's certainly not staff recommendation to extend this beyond today.
All right, Commissioner Holmes had a point.
Medicare Advantage, can someone speak in more detail regarding Medicare Advantage, what savings are going to be and how that could impact those particular employees? And who will provide the Medicare Advantage program?
Okay. Aetna will be providing the Medicare Advantage program, and it is just for our retirees that are 65 and older. Those retirees, the plan will remain the same. There will be no changes to the current plan, but there will also be some incentives that are being offered to those employees at no cost to the employees. So there will not be any increase in what they're currently providing, and it is, again, being provided by Aetna.
On what the incentives are. I mean, what does that mean from a monetary or non-monetary to the county
Okay,
as
give me
well?
1 second. Some of the additional services that they will be able to provide will be what they call a care advocacy. What Aetna will actually do is, for all new members, they will be required to do a survey. And the survey gives Aetna an opportunity to understand the employees that are going to be under the current provider. As part of that survey, they will now provide what they call healthy home visits to our retirees. And again, this is certainly at no cost to the retirees. This is all voluntary, and it's an additional incentive and service that they will be providing. Additionally, they will also make sure that they are coordinating with these retirees and making sure that they understand the plan that they currently have. But again, everything that they're adding as the additional incentives are at no cost to the employees.
The incentives that we're referring to that are offered to Henry County current employees and the group enrollees. And because we said that we will offer incentives in the resolution for employees, and if they choose not to enroll, there will be incentives. Those are the ones that we're interested in as well.
That's correct. And what I will do is I'll have Fred come up and explain the incentives for those employees that are actually electing, if they elect not to take on the county's insurance. Yes.
When we're talking about comparing apples to apples, and I hear that we need to move expeditiously, I have to look at the savings, and I keep going back to the $262,000 savings. I'm still not being able to see the rate that the employees would increase on their insurance compared to what we're increasing on with the Blue Cross Blue Shield.
Okay. Can you answer the question about incentives, and then we'll come to this question, because that does open up, something that we need to go back to. So if we could address the question on the incentives, and then we'll come to this question, I would appreciate that.
Thank you.
The incentive program basically says that if an employee today is on a plan and is taking an employee-only coverage and moves to their spouse's coverage, if, in that case, if they may both have their own plans, but now if they move theirs over to the spouse, they would get a $100 per month payment, which at this point we're looking at putting into a a savings account. If they're presently taking the spousal coverage only, there would be a $300 a month incentive to move to the spouse's other coverage. Same thing if they are employee and children, $300 a month. And if they presently have the family coverage with our program and they move to their spouse's family program, there would be a $400 a month incentive to move.
Great, okay,
And
thank
for
you.
those employees today who are not enrolled but are eligible to have enrolled, there would be a $100 a month incentive to them to stay unenrolled.
Got it. Okay, thank you very much. Okay, let's move back to Commissioner Clemens' comments about the savings that is predicted or was shown in the analysis by Mr. Aletta. Okay, Commissioner, you want to restate your question again so that we're
So
clear about
since
that?
we're expecting to vote on this today, and we're looking at savings, I think I understood that when Mr. Aletta stated the Kaiser plan, that the employees' amount, even though that we were saving $262, the employees' amount was still increasing? Is that what you were saying?
52 is net of taking and trying to get as comparable between the two plans by moving them first into the multi-choice 100% versus leaving them in the same HMO. And secondly, where their rates they were going to charge on multi-choice are higher than what we would charge our employees under the 80% plan.
Okay.
I've used those figures to reduce it so that there's no increase over and above still, because obviously the more you charge the employees, more savings that they will show, because the savings is coming from more charges to the employees.
Okay,
Okay?
that's my question.
All right, other questions, comments from the board? Commissioner Wilson, then we go to Commissioner Holmes, and I'd like to make a comment as well.
Fred, can you, when you said that it's $100 savings and for if they choose to move it to their spouses, how does that $100 savings work per month? Where does it go and how does employees have accessibility to that?
Our discussions at this point, what we'd like to do is put it into a, get the exact terminology, I'm sorry, a health reimbursement plan, so that the money we would give them would go into this health reimbursement, and they would use those funds to then pay their co-pays, deductibles, and everything else out of those funds. So it would be used for the purposes of paying their out-of-pocket cost, if you would, during the next 12 months.
Okay, thank you.
Okay, Commissioner Holmes.
Fred, so between Kaiser and Blue Cross and Blue Shield, I think, Sherry, you told me the combined premium was about $21 million this year, correct? So if we went Blue Cross, sole source, would that premium be the same or would it be more? And what would it be if it was opposite for Kaiser?
The combined plans that we have going forward as recommended was a $21 million cost, total cost. That's with Aetna, Kaiser at the 180 in Kaiser, and the 1,234 still in Blue Cross. Blue Cross said they would reduce their rate 1.2%. And then, but on the other side, the 180 employees that are enrolled in Kaiser would then come over to the Blue Cross plan, and since the Kaiser rates are less than the Blue Cross, then the savings we get from the 1,234 at 1% ends up being lost because of the increased cost for the 180 that are moving over to Blue Cross. So there is no savings there. So you're basically going to be looking still at 21 million. It might be a few dollars more, but it's going to be very, very close to the 21 million. Just because it's a wash bringing the 180 Kaiser enrollees today into a higher costing Blue Cross plan, even with the 1% reduction.
No, I thought that number with Kaiser was about 18 million.
It is on Kaiser alone, but then you've got Aetna cost and Kaiser cost for the 180 that gets added to the 18 million to get to the 21.
The 21,203.
Other comments, questions? Well, what I would like to say that I know we invited in some of the providers to come up, but I am going to trust the research that the staff has done. They've compared and they've done research, granted that we're under a tight constraint here. I do feel better as the research that you presented today, because you've gone in and you've studied and you've compared apples to apples as best as can. And I'm also very glad to hear that we're not going to be in this predicament next time. Meaning that we're under a rush decision, but you all have been working. I know you were working some over this past weekend as well, preparing for this resolution. And I do understand that we've got some time constraints. I also understand that we are in a cost-saving mode because we've had a preview of what we're going to have to look towards in our general fund. So again, we are looking at how do we balance this given the timeline that we have. And so are there any other comments from the commissioners before we begin to open the floor? Yes.
I have to come back to somebody throwing out we could save 1.3 million. I do not like that. I don't like when people throw out numbers without us being able to rebut the numbers or verify the numbers. Is there any possible way, we're just talking here, we could take a short recess to take a look at this? I don't know if you can do that real quick, but again, I do not like when somebody comes up and tells me I'm going to save 1.3 when we haven't had a chance to dig into it. As a citizen, I would be very angry if we made a decision on this board without thoroughly vetting the $1.3 million savings.
Again, a week ago Thursday, we received from Kaiser their rates.
Right.
That's when I didn't understand what's a 500 OOA and all these other 3 plans and what sub-plans and whatever.
Right.
That's when I did what the analysis you showed, but I took the 3 million because it was the most savings they were talking about.
Sure.
And as you see, I whittled it down, not intentionally, but just putting it down, it came to 262. Last Thursday, you received, if you would, in an email, I think Commissioner Clemens passed it over to me and I'd received it as well, a new plan that was, so there were 3 the previous Thursday, and on Thursday, that last Thursday, there was a 4th plan, and it was called a 500 OOA, which I understood to be comparable to the Blue Cross, the Blue plan. And in that one, and again, their savings, they said, was $1,089,000. Right. Okay? I took that plan the same as I did just now with the other 3 million plan, and instead of it being a savings, it's a cost of $1,200,000. And what I mean by that is the same thing. I moved employees that they had over here. Let's get this right. Yeah. Yep. I eliminated this line here and said they all go here under multi-choice. And that changed. Now what I didn't change is they're charging the employees, as you can see here, 161,320, maybe you can't, 161,322, 288, and 521. When you charge that much money of the total premium to the employee, it's not a savings. Exactly. So again, I'm not trying to pick on it, I'm just looking at numbers. And the numbers I'm showing you, again, under this plan where they'll save $1,089,000, you can see they're the same rates, but there's the rates they were using up above for the HMO, Kaiser HMO, which I've eliminated. As you see here, they were putting 302, 129, 28. And what I did is I took them all out and put them into the choice. So in doing it that way and not touching anything else but moving them there, the calculation comes out to $1,200,000 increase as opposed to $1,089,000 decrease.
Well, thank you, Mr. Aletta. We've heard a request for a quick recess, so is it the pleasure of the board to take a recess before we come back? Or you want to keep it?
I mean,
You want to take a recess? Let's take a recess. Okay. All right. Thank you.
Fred. I took mine back from Fred.